Hi everyone, I'm John Colucci here with KOMO News doing a Q&A on mental health in the age of COVID-19 and coronavirus. I'm here with Justin Peer, who is a psychotherapist and owner of Clarity Counseling in Seattle. So Justin, welcome and thank you so much for joining us.
Thanks, John. Happy to be here.
Yeah. So like I said, today we're doing just a quick Q&A about mental health right now with everything that's going on with coronavirus. A lot of people, myself included, who've dealt with anxiety, depression, and other mental health conditions. A lot of that is exacerbated right now by what's happening. And there's also a lot of people that are new to these feelings or kind of have different feelings based on the current state of the world and their country and their lives and all of this new normal that we're all kind of experiencing, or not kind of, are experiencing, I should say. So we just wanted to take some time and try to answer some of your questions, folks, from social media. And hopefully Justin will get some of them answered. And then we hope to, maybe have more of these in the future, but we really hope this will be helpful to you. So the first question I have for you, Justin, is depression in general. So it's high for a lot of people, particularly people who maybe don't experience either of these things or really have sensed them before. So for those that are new to these feelings, what support or thoughts might you have for them?
Yeah, absolutely. A bunch of ideas there. Yeah, and you're right. We don't have to have clinical anxiety or depression to be experiencing what we're all going through right now. So it's a really normal reaction actually to a very abnormal situation we're in. So a number of things, John. So limiting your news, limiting the exposure that you have to the stories that are out there is an idea. It's good to be informed. You get to be as informed as you decide to be, but really limiting the amount of information that you take in. There are a lot of stories that we could read about what's happening in the world that may be increasing our anxiety or our depression or our stress. So be aware of what you're taking in. Sometimes we suggest scheduling maybe just a couple times a day that you check in with what's happening. Focus on self-care, whatever self-care means to you. What do you know about yourself, or what can you learn about yourself that helps you to relax, to be more in your body, to be more present? It may be exercise, it may be taking a bath, it may be talking to certain people, but get a better sense of what self-care is for you and then make sure that you're implementing that. Exercising, using your body in some way. That could be as simple as stretching, or it might be going for walks. We can actually be out walking and also with someone else from a distance, right? So make sure that you're using your body. It helps to get us out of our head and more into our body and our senses. Breathing and relaxing. I know we're all told to breathe, but there's really something to that. We're really shifting our physiology. When we breathe in a deeper, more intentional way, we're shifting our physiological state and our central nervous system. So breathing, but also trying to relax. Be aware of when your body is tight or tense and see if you can relax those muscles. Okay. Something else that's helpful is practicing mindfulness. And you can use apps like Calm or Headspace are really popular mindfulness apps. If we weren't in this time, I suggest doing an 8-week course that is mostly used around the world. It's called mindfulness-based stress reduction. That's a great way to really deeply get into mindfulness. And there might be that online, actually. I haven't looked. But for now, it's enough to use these apps to teach you some basic mindfulness skills. And mindfulness is about learning to be in the present, which is a simple idea, but it's a hard thing to do. Along the lines of mindfulness, reading a book. There are tons of books about anxiety, stress, depression. I love a book called The Mindful Way Through Anxiety. It has a lot of information, but a lot of activities that you can do. So The Mindful Way Through Anxiety. You can lean on social supports. Who's in your life that you can talk to, that you already talked to or that you haven't talked to for a while, that helps to help you to be more calm, to be more present, to feel more connected to people, which of course we really need right now. And you can always get into therapy or get back into therapy. Therapists are actually really working. We're all online now, but psychotherapy is still absolutely an option for you for people that find that they need that. So those are some ideas.
Great. And even the first one you mentioned about limiting news exposure, working in the news business, we completely agree with that. I think we don't expect people to be 24/7 looking at all the information. It's like take it in chunks, get the information you need, and then kind of move on. I think even myself, I've stepped back from not having the news on all day at times,
Sure.
just to catch in so that I'm focused. So those are some really great tips. And I also recommend that Calm app too.
Great.
For parents that are, so a lot of kids, well, obviously, I'd say a lot, all these kids are home, parents are home, everyone's at home now, because school and work is, obviously work from home, and schools are closed. So for parents that are stuck at home, it's a lot to handle, a lot going on. What advice might you have for some parents to kind of stay calm and just manage through this time?
Yeah, absolutely. Um, Communicate with your partner, plan with your partner if you have a partner, right? Try to work as a team, especially if both of you are working from home, and a lot of couples are. Get ahead of it. Don't wait until the challenges, the stresses and strains of this new arrangement with your partner or with your family come up. Try to talk ahead of time and anticipate some of the challenges that you're going to have together. Try to problem solve and troubleshoot ahead of time so that you are working as a team. You're interacting with your partner and really maybe with your family in a different way here. And so it's really asking for you to be intentional about that. And it takes communication and being really upfront about important conversations to have. Take breaks often. Take a break from your work, walk away from your computer, walk out of your house. Take breaks from your partner, from your children, if it's safe to do that. But break up your day as best you can. Disconnect from your devices on your breaks. Leave your phone behind. Going for a walk around the block without a phone can be just really powerful, right? So disconnecting for a while. Having clear boundaries so that you can separate your work from your non-work time. And those are physical boundaries. Make sure that you have a working space that is separate from your living space. And you really just get in work mode when you're there. And when you leave that working space, you're not in work mode, so that you can be with your family. You can be in a non-work state of mind. We have to be careful to not let this working state blend into the rest of our day and our evening. We need to have those boundaries there so that we can disconnect from our work lives as best we can. And call in resources. See if you can get some reprieve from your children. If you have resources, family nearby, are there ways that you can call on people who are willing to help you to get even 30 or 60 minutes away to break up your day a little bit? So really calling on any resources that you have in your life, in your personal or your friend life.
One of the things that I read is that one key to what can cause anxiety for some people is the factor of control. So especially if they're going on, there's a lot of what's happening that we cannot control at all. We can control staying at home. We can control, aspects of our lives, but we can't control the disease. We can't control any of that stuff. So how can we deal with the difficulty of control and if it exacerbates our anxiety?
Totally. Yeah, that's a really important concept, right? And there's so much that we can't control right now. So you may be familiar with what's called the Serenity Prayer, right? And it's actually, that prayer is very long, but the first part of that is what people usually quote. And it's typically used in drug and alcohol treatment, but it's applicable. I think it's one of the most wise phrases or mantras or things to live by that there really are, and applies to so many things. That certainly applies to what's happening now and this concept that you're asking about of anxiety and control. So the essence of the Serenity Prayer is, give me the serenity to accept the things I can't change, the courage to change the things I can, and the wisdom to know the difference. Right? It's a simple concept. It's a hard thing to do, right? But we often see people in therapy who are struggling with one of those two things. They are trying to accept something that they don't think they have any ability to change. They actually are in power. They have agency that they didn't realize they had. And other times they're doing the opposite. They are thinking that they are powerless when they are trying to change something that they can't change, right? And the situation we're dealing with right now, there's so much that's out of our control. So it's do what you can within reason to affect the parts that are in your life and accept the rest. That's a hard thing to do. It's a really easy thing to say. It's a really hard thing to do. We're asked to accept a lot of lack of control right now. But the last part of that, the wisdom to know the difference, is really the heart of that. To get better, more skilled, and we have to practice it to get more skilled, at noticing, is this something for me to change and realize I can actually work on, or is this something that's out of my control and I need to accept? In addition to that, returning again to mindfulness, to the present moment, coming back to where you are. Control is typically not about what's happening in the moment. Usually the present moment is controlled. What we're worried about is what we imagine in our minds about the future that would be out of control. So coming back to where we are, which is where we're stuck anyway. Again, breathing, realizing that you are in the present moment, that nothing that you've anticipated has happened, right? You are in this moment, you're okay. You have food, you are not sick, right? Connect to your senses, right? Sometimes it helps to have a motto. We use this in different ways. I do relationship and sex therapy, and often our motto is lose your mind and come to your senses, right? Lose your mind and come to your senses. Come down out of your thinking, worrying brain, which is where all that anxiety and control comes from, and come down into your body with breathing and noticing what's happening around you and with you. What do you feel? What do you taste? What do you smell? Right? It's amazing how powerful that can be to get us away from anxiety and this need for control. Right? And then lastly, you can control the choices that you make. Right? So thinking through, related to self-care, what are the choices that I can make that I know are good for me? The part that I can control, which may not be a whole lot these days, but what can I do something about?
Earlier, you mentioned a couple resources like the KOMO app and Headspace, and I'd love to ask, more in terms of if people have decided that they want to seek therapy right now, whether or not they, maybe twofold. One is where can they start with trying to find a therapist? And also two, if someone isn't able to, maybe insurance doesn't pay for it or they don't have the financial means to cover it, what might be some resources that they could look into?
Yeah. So you mentioned the apps, John, and Calm and Headspace are the most commonly known and used. I have a few others on my mind. Let's see if I can remember what they are that are really good. So, and you had mentioned actually DARE, right? DARE, DARE for anxiety and panic. Another called Rooted, ROTTD, and that's specific more for panic, for people that experience panic, which is a form of anxiety, of course. If I'm remembering the name right, I think it's called Acupressure Heal Yourself. And that's more for relieving muscle tension and pain. It's for headaches, it's for indigestion, more the physiological effects of anxiety. An app called Sleep Time, which is obviously for sleep. An app called Colorfy. It's an adult coloring book. Actually sitting there using a virtual or a real coloring book does that mindfulness I mentioned of coming back to the present moment and focusing on one thing that's here and now, which is just simply what you're writing on, right? Because anxiety is leaving the present moment and going into an imagined future, right? So a coloring book and using that app, it was called Colorfy. Again, the book mentioned, The Mindful Way Through Anxiety, is a cheap way to do your own self-help at home. But as far as therapy, yeah, you can always Google in your area for therapists, maybe with a keyword of anxiety, stress, depression, relationships, and see what comes up. You can use psychologytoday.com. We typically see the magazine, but the website psychologytoday.com is a way to find therapists in your area. And then as far as lower cost therapies, I'm not sure what cities this is going into, but in Seattle here, we have a couple. We have the Open Path Collective, and we also have Mend Seattle. Both of those are lower cost. I think sessions are $50 to $75. Although if you reach out to therapists in the area, if you have health insurance, you might just have a copay that might be as low as $10 or $20, which might make therapy accessible for you. And even if you work with someone who isn't in your insurance network, sometimes we have good out-of-network coverage that allows therapy to still be affordable.
So I know in your role, you're not a prescriber, of medication, but something that may come to mind for some people is now the time to start thinking about medicine if I need it, and particularly if it's just the antidepressants or if it's benzodiazepines like Xanax and such. Again, I know that's not your specialty, but do you have any thoughts about if people think that that's the route they should go, or just thoughts on that in general, really?
Yeah, absolutely. And not every therapist agrees on how we look at medication for people,
Mm.
but more times than not, we say some brains and bodies need it. And while we don't suggest that people rush out and jump on a medication, and we always recommend if you do medication that you do therapy as well. And really, no doctor or psychiatrist should be prescribing medication without also suggesting therapy to go with it. But sure, some people need medication, and definitely talking to your doctor. If you prefer Western medicine, you might talk to your primary doctor. If you prefer Eastern medicine, you might look into naturopaths. I know in Seattle we have a ton of naturopaths, but they're all around the world. It's just a different approach. So there are a lot of non-psychiatric med approaches to anxiety and depression and stress, a lot of natural remedies that perhaps your primary doctor wouldn't have suggested. So that might be a reason to look into a naturopath. One other consideration, John, is that when it comes to psychiatric medications, with all due respect to doctors, typically they are woefully trained in psychiatric issues. That's really left for people that we're calling psychiatrists and also ARNPs. And an ARNP is a psychiatric nurse that specializes in psych issues. So a psychiatrist or an ARNP, if you have the choice to get prescribed medication through them rather than your primary doctor, it is what we recommend.
A friend of mine personally posted something about this on Twitter, and it's something I had not even thought about. Is people who are in recovery from, say, alcohol or drug abuse or something to that effect. And right now, this is a lot tougher for them, not just because of, what's going on, but in some cases, those who went to like AA meetings or NA, Narcotics Anonymous meetings or support groups for that may not be able to physically go to those meetings because of everything going on. So do you have any thoughts for them and any thoughts on how allies, can support them?
Yeah, absolutely. Yeah, you're right. My understanding is most AA meetings are shut down right now as they need to be, right? That's a collection of multiple people, and we just can't do that right now. Yeah. So there are online. I'm not deeply familiar with it, John, but there are online or virtual AA and NA meetings. So I Googled that. Yeah. So see what's there. That should be relatively easy to find. That should be searchable on the internet. So see what's happening online. And if they're not, the ones that aren't already there, I know actually that they are in the works, that people are moving more to this format given what's going on in the world right now. So there should be more options soon for online meetings. Connect more with your sponsor. Reach out to your sponsor by phone or even better by video chat. You could also meet in person if you keep your distance, right? But talk to or lean on your sponsor more than you might have typically. Adhere to your sobriety plan. Maybe check back in with what your sobriety plan is and make sure that you are following steps that you've already established are helpful to you that may not include the in-person AA meetings or NA meetings. Lean on social supports by phone or virtually or in person from a distance. Lean on people that you know are helpful to you. Be willing to ask for help. And you asked about the allies. Yeah, so we can be more proactive in checking in with people we know that are struggling with addiction, not waiting for them to reach out to us, but checking in with them now and seeing how they're doing and spending time with them virtually, on the phone, online, in person from a distance, right? But being more assertive with them, proactive with them, and ask them how you can help, right? The person knows best what they need. We don't need to guess. We can ask them, how can I better support you given this time?
How can we try to avoid thinking so much about the future and kind of just focus on the now and living in the moment?
Yeah. So it is part of what we talked about with mindfulness. But it's worth mentioning, John, sometimes we, in order to not try to think about and imagine an unknown future, we try to stop our thoughts, which tends to not work very well. It's not really possible to stop our thinking. Our thoughts go to an unknown future, and it's our brain's way of trying to make sense and plan and get some sense of control back by trying to see what's going to happen in the future. But we can't stop that. But what we can do is we can get better at redirecting it. Instead of, sometimes I use an analogy with my clients. It's kind of like the difference between karate and Aikido. And karate is a contact sport. It's force with force. Right. And sometimes when we try to stop our thoughts about an unknown future, it's like we're trying to fight it head on. But what tends to work better is a redirective approach that's more like Aikido, this other martial arts approach, where you are not so much fighting the person, but you're waiting for them to come to you, and then you're using their momentum, kind of getting out of the way. If you're old enough like me to remember these old movies with, of course, Steven Seagal, it's basing on his name, Steven Seagal. He didn't fight. He waited for the person to come at him, and he got out of the way and used their momentum against them. So we can try doing that with our thoughts, where we don't stop, but we recognize, I'm worried about the future. I'm trying to imagine. I have these images about things happening in the world, like Italy, or things happening in my family, or with my job, or the economy, and gently redirect your attention back. And it needs to be gentle. Don't fight with yourself, but gently redirect your attention back to the present moment, and back to breathing, back to your body, back to what you see, what you smell, what you taste, what's happening in the present moment, right? But not fighting yourself, but just kind of redirect yourself back, okay? It can also help to have a mantra of some kind. It can be as complex as you want it to be, but typically having something really simple that we remember and we go back to, like, be here now, be here now. Or a common one is, this too shall pass, right? Or I don't need to see the future right now. I don't need to see the future right now. I get to be here right now. But something that you say to yourself, that you're training yourself to do that redirection, to come back here, right? And take action on what you can control, right? Do what you can. Recognize what are my choices here? What is my agency in this moment? That's the part that I can do something about, to prepare for an unknown future. And then the rest is really the part that's out of our control. So coming back to where you are. We're stuck where we are, but there's a lot of relief if we can surrender to being stuck where we are in this present moment. We don't need to be in the future. We don't need to see the future. We can't anyway, but we never need to. We just need to practice being here now in a way that's more as calm and relaxed and present as we can allow ourselves to be.
So obviously we're all being told to stay at home. Well, at least here in Washington State, we're under stay-at-home order, and many other states that will show this in too are part of this. But regardless of whether we're under order or not, we're supposed to stay at home. And social isolation, that is a tongue twister. Social isolation is really tough, particularly for extroverts. But even me, who's an introvert, I'm even feeling this urge to be out and be social. So how can both of us, verts, if you will, handle this period of social isolation and loneliness?
Yeah, absolutely. And that's an important point. Even introverts absolutely still need human contact, right? It's just about where we get our energy, from people or from recharging by ourselves. So for social isolation, John, go see friends. You can actually go and you can spend real time with real people, right? Just stay at least 6 feet away, right? Mm-hmm. Make sure that you really do keep that distance. I had a 20-minute talk with my best friend the other day from about 10 feet away. I hadn't seen him for a while. And we made plans to be in the same space, and we're not around anybody else. We're just around each other, but we're plenty far away. So we're adhering to the safety precautions that we all need to follow, right? But we had a meaningful interaction. So it's not that we can't be outside our houses. We can. It's not that we can't walk with one other person. We can. And we suggest that we do that. So you can be out physically. You can be out driving. Drive around. Get in your car. Drive where other people are. Go to your favorite places. Go to where there are other humans, even if you're not interacting with them, although you can from a distance. But you can be around other people, and that can give us a sense of connection and closeness, even if they're not people we know or we're not actually talking with them. Absolutely using online apps. There's a huge surge, as you're probably aware, of people moving to these online applications like Zoom and the others, and even just using FaceTime. Mm-hmm. Getting creative. People are getting creative with things they're doing. They're having coffee dates with people virtually. They're having dinners. They're having couples dinners with other couples virtually. Families are getting together. My family, the 5 different groups of people got on the same Zoom call for 2 hours, and it was a blast. It's not the same as being in person. It's what we can do right now, and it really helped us to feel more connected, less isolated. Make phone calls. Connect with old people who are old friends that you haven't talked to for a while. Who have you not put enough time into nurturing your relationship with, right? You have plenty to talk about now, right? Call them, text them, Skype with them online, right? Meet with them from a distance in person, right? But reconnecting with people that aren't currently in your life. And using social media. There's a huge push with Facebook is overwhelmed right now with how many people are using social media. So that can be a way, if that helps you to feel closer. Sometimes Facebook can have, or social media can have, the opposite experience of feeling distant or feeling like your life is not what other people's. But right now it's or that social media is creating comfort and connection for people.
Yeah, all those like vacation photos that used to clog my Instagram. It's like, those are gone for not the best reason, but okay, that's not there for.
That's right. No one's on vacation right now. Nothing to
Yeah.
feel about.
Like, nope. Or I'm actually, a couple of people are doing, like, I've seen throwback photos that are like, oh, a year ago I was in the Maldives or something, where I'm like, okay, good for you. You're lucky. But thanks for that. You talked a little bit earlier when I was asking you the question about, like, parents being stuck at home. You touched a bit on the relationships, and obviously you're, in your expertise, you do a lot of this as sex and relationship therapy. So maybe twofold on this question is, just any additional thoughts you have for couples that are spending more time together, working at home. They're in each other's space a lot more than they used to be. They might have had that 8 or 9 hours separate each work day to go out, be separate. And then maybe a second layer to that is people that may be just starting relationships that are, are single and are still kind of interested in dating. So any thoughts for them in general about kind of managing love and relationships during this time?
Yeah, totally. So like I mentioned, being really deliberate and intentional in talking with your partner about how to manage your time together. You're shifting your relationship. It's not affecting everyone in this way, but a lot of couples are affected. It's creating a different dynamic to be spending this kind of time and this amount of time together. So really having open lines of communication where you're talking about your feelings, your needs. You're making really clear requests of each other, not demands, but requests. Ask for things that you need. What's going to help you with your workday? What's going to help you with what you're experiencing, spending more time with your partner now, right? They can't read your mind as well as they know you or as long as you've been together. They don't know what's happening with you and what you need until you let them know, and make a really clear request that they can say yes, no, or something in the middle too. Okay. Give your partner some grace, right? Give them some patience. This is tough. It's tough for you. It's tough for them. I'm hearing about couples getting on each other's nerves and having, frayed nerves and getting short with people. That's really understandable. And we need to just really keep an eye on that so that we can be really patient and forgiving and empathetic with what our partners are going through, which is probably really similar to struggles that we're going through. Make time for intimacy. I'm a sex therapist. I'm going to mention sex. Make time for intimacy, whatever that looks like. It doesn't have to be intercourse. It can be all sorts of things. But make sure that you prioritize that part of your relationship as well. It's harder for various reasons given the configurations we have at home right now. But find ways to be intimate. That might be as simple as taking 20 minutes to give each other back rubs or to just sit there holding hands and talking. It might be laying down in bed together. It might be taking a shower together. It might be sex, intercourse. It could be anything. But what is intimacy for the two of you? Make sure you carve out time for that. And in doing that, see if you can shift from being in this mode of working or of, coworker to your partner all day. Shift to ways where you are more feeling like a lover to your partner. What do you need to do? Do you need to take a shower? Do you need to brush your teeth? Do you need to change clothes? Do you need to put on cologne or perfume? What helps you to connect more to your sexual self so that you can connect to your partner in more of that intimate way, whatever that looks like for the two of you. And you can always do couples therapy. Like I said, therapists are absolutely working and working with individuals just as well as couples these days. So if that's an option for you, doing couples therapy, especially if the two of you are really struggling, which we're hearing that's definitely happening for couples, they're needing some help. So feel free to reach out for that. There are resources probably wherever you are in the world. And then John, you asked about dating. Yeah, it's of course a tricky time to be dating. I hear about people meeting each other online and yet not having the option to meet in person, or at least they don't think they do. So there is, online only dating where you accept that you're not going to meet in person right now. And you use phone and email and most likely, online resources to connect. I mean, in some ways it's neat. It's slowing people down. It's actually eliminating some of the sexual stuff that can happen and focusing more on friendship, right? So perhaps you even have a better chance in creating a solid foundation with someone you're dating if you can't spend a whole lot of time in person with them right now, because it takes the sexual element out of it, or at least part of it. And instead you're focusing more on connecting, on letting this person get to know you and being open and vulnerable as much as we do when we're first dating, and creating a solid foundation. And even our loving relationships are still based on friendship. So this could be good for relationships in some ways. But also, having said that, you can still spend some time together if you can keep yourselves from a distance, right? You could plan to be in the same place as this person that you want to see in real life, in real time. Just, of course, make sure that you're following all the precautions, right?
Absolutely. Justin, this has been amazing advice you've been giving us. I was open about my own challenges, and I had my own therapy session yesterday, and I feel like I've even gotten a second one for complimentary one this week from you through this, and I'm sure others that are that are watching this too have gotten a lot of information. So thank you. Is there anything else that you feel like you want to share with people? Just any other insights about mental health or things right now as people kind of go through this uncharted territory that we're in?
Yeah, well, I was thinking, John, when you and I chatted earlier, you mentioned this hypochondriacs or hypochondriasis.
Oh, yes. Sorry.
It's fine. No, I was just thinking about that a little bit. So I thought I'd just mention kind of the basics. So something that can be helpful if we can be what we might call hypochondriac, which is typically believing that something is wrong with us physically or medically that isn't, right? And worrying excessively about things that may be happening. So it can be helpful to look. Sure, it's a lot of people. It's really common. I think it's actually 1% to 5% of the population. Actually,
wow,
it's a lot of people, tons of people, millions of people. So look at the evidence, right? Take a step back and see if you can kind of play detective. Try to look objectively at your situation. Sometimes it's helpful to kind of pretend that you are advising a friend who's having these strange symptoms that might be happening with you. You might ask yourself, what's the evidence that supports the idea that I've got this COVID-19 illness? What's the evidence? What's actually here? What do I know, right? And then it's looking at, make sure to, like we talked about, limit your exposure to the news, which can often highlight the worst of what's happening, the most sensational stories, with all due respect. If you can, get checked out by your doctor, right? To just rule out that there's something actually happening with you. It's good to get checked out. And right now it looks like many of us are having to do telehealth only, but your doctor is accessible to you, absolutely, if only to do a virtual session. So be willing to reach out. Remind yourself that you won't ever know for sure that your health is perfect. We have to learn to live with that uncertainty, as we really do with all the other unknowns, right? So living with uncertainty. Try to be really kind to yourself for the distress that you're feeling when you're worried about something happening with you. Be kind and gentle with yourself rather than being critical or judgmental with yourself. And of course, seeking professional help as needed. There are certainly therapists who specialize in hypochondriasis, although you don't necessarily need a specialist in this, but you can talk to a therapist online and see if they would be the right resource for you. And, John, if it's okay with you, I also wanted to mention, I thought of something else. Yeah. And an article was just written about this in, I want to say, the Harvard Business Journal, if I'm saying that right, but about grief. That one way to look at what we are experiencing right now is that we are all in this collective state of grief. We don't tend to think of grief and loss as something that's happening on more of a daily basis. We tend to think of what happens, of course, when we lose someone or something, or when there's a breakup. But we're in grief and loss states actually a lot of the time. We're often grieving things that we wouldn't be aware of. It's pretty insidious and subtle. And so, a lot of things are lost right now for a lot of people. A loss of normalcy, a loss of connection, right? A loss of our mobility, our independence, a loss of a sense that we aren't going to experience something like what we're experiencing. Most of us perhaps didn't think this was going to happen. This is kind of rocking our sense of this happens to other people maybe in other countries. This doesn't happen here, but it's happening to all of us in a huge way. And we're grieving the loss of the security that wouldn't happen, because it is very real and it is happening, right? So the stages, I don't know if you remember we often think of the 5 stages of grief, of denial. See if I can remember all these. Denial, anger, bargaining, sadness, sometimes called depression, and acceptance. Right? Denial, anger, bargaining, sadness, acceptance, right? And it's also worth mentioning there's a 6th stage that we're talking about now that's more about finding meaning. So finding meaning in the loss, okay? But it's important with these 5 stages to remember that we don't go through them in a linear way. We go in and out, we bounce in and all of it, in and out of all of it. We might be in a state of denial, and we might move from denial to going through a period of sadness. Then we might maybe move from sadness to acceptance that lasts for a day or a week or a year. And then you might go back into anger, right? So it goes all over the place. So be careful. What we say about grief is just be careful about assuming that it's going to follow any kind of course and then you're through it and it never comes back, right? So grief comes and goes. And then lastly, a couple things about grief, what to do about it. Right? Understand the stages I mentioned, right? Denial, anger, bargaining, sadness, acceptance. But also remember that, like I said, they're not linear, right? And we're also experiencing a lot of anticipatory grief. And we're anticipating grief, we're anticipating loss, John, because things are happening now, but we also know that there's more that's going to happen, and we don't know what that is. And so we are feeling some of that grief ahead of time, which is really just another form of anxiety, right? Where our mind is going into the future and imagining the worst. So we're anticipating grief, or sometimes called pre-grieving, grieving ahead of time, right? So again, the final thought about grief is, again, to come back to the present as best you can, to calm yourself, right? Again, mindfulness. Come back to this moment. And if you have moments of grief, whatever stage that is, allow for that. Allow for it. We don't want to feel the feelings that are there usually because they're unpleasant, and yet we can't move around grief. We can only move through it. So allow for grief and be willing to share that with the trusted people in your life that you can lean on right now.
Yeah, as you were talking about grief, I was actually thinking a little bit about, there's severities of like, what are those things that we're grieving? We're grieving, I have a cousin who's, it's her senior year in college and she's going home already. There's going to be no commencement for her, culminating these 4 years. Or, but even something more like sports fans, that there's no March Madness, or there's no, baseball season's getting pushed back, and those kind of normal American global activities of sport, Broadway being shut down, a lot of shows that people enjoy, the production has halted. So it's like, even, there's the more serious things, but even those little things, that we enjoy, I could see people grieving over that too.
Absolutely. Yeah. And those shouldn't be minimized. They all make up our daily life and our routines, and things that are predictable, and things that we look forward to, and things that we planned on having in our life. And when they're taken from us, regardless of what they are, we feel the loss of that. Yeah,
really, really, really profound and interesting. Well, I can't thank you enough, Justin, for your time today. This has been remarkable, even super helpful to people in Seattle and around the country and the world that'll see this. And we'll certainly follow up with, hopefully more of these sessions in the future. But I want to thank everyone for taking the time to join this Q&A, and wishing you well. And thank you again, Justin, for your time.
Thank you, John. Take care.
Thank you.